going to start recording. We're recording. We will post this meeting on the HSC website within, I don't know, some days, um, if people are looking for it in the future. Um, there will be another opportunity for announcements or updates or tidbits of information at the end. But I do, sorry, lots of people in my waiting room. Hold on. Please hold. All right, everybody's coming. Um, I want to make sure to give Shawna and David enough time for their presentation. I was in a version of this presentation that they had to go fast, and I was like, oh, I wish you could go slow. So they're right at the top of the agenda. We're going to get started with them today, and then we're going to hear from JD Drader about some of the upcoming changes to health insurance, and then there'll be time at the end for announcements or any like trends or topics that people want to bring up. All right. So without any further ado, David and Shawna are here to talk about the Tompkins County Housing Snapshot, and you should be able to share your screen and all those things.
Hi, everyone. Thank you. I'm Shawna Stevenson. I'm Housing and Community Development Planner with Tompkins County Planning and Sustainability Department, joined with my colleague David West, who's the Director of Housing and Community Development here in the county. And I'm just going to get my PowerPoint on, so give me 1 second. Oops. So hopefully everyone can see just the screen, the main screen here now, and can hear me okay. So again, I'm Shawna. I'm working with the county and we produce the housing snapshot that keeps track of our housing development here in Tompkins County based on the 2017 housing strategy that was adopted by Tompkins County. Let's see if this is going. So some background for why we do a housing snapshot. It's a periodic report based on metrics that were beginning to be tracked in 2017 based on a housing needs assessment done in Tompkins County in 2016. And this was to keep track of what we had anticipated would be the units that are in demand, given the housing shortage that we were experiencing even back then in 2016. So some of the metrics that have been tracking since then are workforce units, or so for families and individuals earning up to 100% of AMI, area median income, units that are available specifically for seniors, those over 55 and 65 years old, supportive and special needs beds, and student beds. And so the snapshot reports and tracks on the trends and conditions of the housing as we have been collecting the data over time and tracking progress towards these goals. And hopefully the report is helpful to local organizations and municipalities to help drive decision making in housing development. So some of the contents for this housing snapshot, again, we've made this report. We have been doing it kind of every other year, but it's kind of as good data is made available. So the sections in the housing snapshot, which is available online as a PDF, includes a demographic and workforce trends, housing trends, the most recent data that we could find. So in this case, although we're reporting right now in 2026 and it goes to 2024, a lot of this is because of the fact that the data is kind of finalized in 2023 and 2024. So that makes it easiest for us to report in 2025 and 2026. It gives us time to collect all that data and create this report. We also looked at labor and Bureau of Labor Statistics, Association of Realtors, our local departments of assessment and GIS, and we had input from local staff and local experts to make sure that we were getting the most localized and relevant data in the snapshot. And also new for this year were equity indicators as part of the county's strategic operations plan. So this is the overall chart explaining how many units have been made compared to how many units were targeted in the original 2017 strategy here. The orange represents units that have been created, and the blue represents the target goal here. So we'll see that a lot of the single family for sale homes did not reach the target on that right side of this screen here. And really, the only targets that were met were those in student beds, and those are counted for like college developments specifically targeted towards Cornell University and Ithaca College student enrollment numbers. So that's how that number is matched. And we see that that did pretty well. Most student housing is market rate. So that was one of the mo only market rate housing developments that were tracked through this strategy. We also saw the creation of 189 permanent supportive housing beds. I mean, the original target was 100, but that target was changed a little bit later on through the Continuum of Care's Home Together Tompkins Plan of 2022 that called for more beds, but we'll talk about that later. Additionally, the rental units, we saw less than half of what we were targeting be created. And these are our best estimates based on data that we got from assessment, Tompkins County GIS department, as well as our own tracking through news sources and local planning meetings and those notes. So, and through our Community Housing Development Fund developments as well. So these are estimates, but it is based off of the targets that were established in 2017 with the strategy. So significant progress was made, but we're at the end of the strategy, which goes toward the projection was towards 2025. So we see that only a little bit more than half of the units we're hoping to see were built. Going into some of the demographic trends that we've noticed since 2013, we did like a 10-year scale to get a good picture of how things have changed over the last decade. And this is a lot of this data is based on American Community Survey data, 5-year estimates. So the population of Tompkins County has remained pretty much the same, around 102,000 since 2013. There's been a little bit of ups and downs, but roughly the same, which is a good baseline because when we look at how the age of our population has changed and the number of households has changed, that becomes significant. So we saw that the number of households has changed. And what does that mean? That means that there's more smaller households or 1 to 2 people in a household instead of 3 to 4. Families are smaller. There's more people living on their own. And so what we see is an increase for more units, even with the same population. So that was an interesting finding. And we also saw that those aged 65 years and older, that proportion of the population has increased significantly since 2013. The chart on the right shows kind of the proportions of age groups in Tompkins County, but we're still mostly a young county in terms of population, where almost half of the population is under 30 years old. Of course, with the university here, that's not too surprising, but we did see a slight decrease as a proportion of the population since 2013. So there are some changes in the age of the people who live here in Tompkins County. As for employment trends, this is from 2014 to 2024. The chart on the left shows the employment counts. And this is total non-farm employment, so not counting those who are working on farms. It's not seasonally adjusted. And it's also representing the people employed in the county by county companies. So it's not about jobs that are available or if someone has a job in a different county and they're living in Tompkins County. This isn't really reflecting that, but it's giving us a good idea of the jobs that are being held in the county. And we see that in 2020, during the COVID pandemic, just like everywhere else in the country, the number of employment has decreased. But unlike the state, which kind of saw the numbers go back up, Tompkins County did not have as many regained employment, employed people. So it just means that there are less people employed in the county. When we look at the actual employment rate, we have relatively low unemployment compared to the rest of the state. So what that actually indicates is a shortage of workers. And so it's not that there's no jobs necessarily, it's just that there's less people for these jobs, which is an interesting comparison here. Looking at housing cost burden for the county, housing cost burden means that it represents a metric where if you're spending more than 30% of your gross income on your housing costs, that means that you'd be considered housing cost burdened. And if you're spending more than 50% of your gross income on housing costs, that means you're severely cost burdened. For renters, that those housing costs include your rent and your utilities, besides internet access. And for homeowners, that includes your mortgage and your insurance and your utilities outside of internet services. So what we can see here since 2013 is that renters have continued to become cost burdened over time. It's a small percentage, but it's an increase over time. And especially when you look at the cost burden shown in those who own their homes, you see that their cost burden has decreased. So what we're seeing is that um, at least 25% of our housing units are experiencing cost burden, right? If there's almost half of the units in Tompkins County are renter occupied. And so there's many reasons why this might be. What we see too is that the rate of rent has increased more than the rate of our increase of median income, among other things. So the cost burden has increased for many people, but especially for renters in Tompkins County. Another metric that we looked at was housing tenure by race. So tenure means if you're renting or owning your place of residence. And the way that race and ethnicity work in the census data is that those answering the survey self-identify, right? So householders identifying as white alone accounted for 77% of the householders in Tompkins County in 2020. So this is based on census data, decennial census data, but they represented 88% of owner-occupied households. So what does that mean? That means that there's a higher proportion of household holders who are owner-occupied that are white than are represented in the overall population. When you look at this chart, the black bar represents the proportion of that race as the total population of Tompkins County. And then the blue represents that proportion of the race in owner-occupied units, and then the green represents that proportion of the race in the population that are renters. So what you see is that any other householder identifying besides white is more than likely to be a renter. You also see this in the Hispanic and Latino community where about 5% of total householders are represented by those identifying as Hispanic or Latino, but they're only representing about 2% of owner-occupied homes. So it just shows that that there is some inequity here, right? And when you're seeing one, um, those identifying as white alone are more likely to be a householder than the other races here. When we're looking at the for sale market, this is just a chart that's showing from 2020 to 2024. And you see that the prices of single family homes has continued to increase for Tompkins County and the surrounding counties. But the difference is that Tompkins County has always been a little bit more expensive than its surrounding counties. So everyone's seeing that increase of price, but the yellow bar, I'm not sure if it's coming in clear through your screens, but that's it, shows what the median income was in 2023 for that county. So you see that Tompkins County is there. We're not earning that much more than the surrounding area, and yet our housing costs are much more expensive than the surrounding area. Additionally, what we saw was that for a home that's priced at $325,000 with 3.5% down, a median wage earner would need at least $26,000 in cash just for the down payment and closing. And that doesn't include the maintenance costs, which could be 1,000 or more a year. So it's very expensive if you're not already in a position to own a home to then buy a home because you would need significant cash. And if you're cost burden as a renter, you're probably not building many savings to be able to do that. More recent data shows that the that people are buying homes closer to what the original asking price is. So for a while since 2020, we saw that people were getting a lot more than they were asking for their homes. There's a really high demand for single family homes here. We're seeing that starting to come closer to what people are asking. It's still um, what we'd call like a hot market, but it's starting to become a little bit easier to buy a home compared to what it was right after 2020 through 2023. And to look at the housing market and just how much it costs to be a renter in Tompkins County, again, you see that the median rent for a one-bedroom apartment is over $500 more than the next highest cost county. And to afford the median rent for a one-bedroom unit, and to not be cost burdened, you'd have to earn over $63,000 a year on your own just for that one bedroom apartment. And like I said before, the median income has not kept up with the increase of rental costs, and that was an inflation adjusted figure that we calculated to show that it was 8% increase for median household income versus the 11% increase of the rental costs from 2013 to 2023. Now we'll go into some of the more specific metrics that we were tracking based on the 2017 housing strategy. A lot of these numbers that we calculated were built off of previous snapshots as well as current data collection from our assessment department and GIS department here at the county. So we saw a little less than 700 new single family homes built. We're not sure if those are rentals or not either, but the original target was 3,800 new ownership units. We also had some goals for how much those units would cost. We were hoping that we would have 900 built for under $200,000. With inflation and especially the increase of cost of construction, especially since 2020, we see that that is closer to being a value of $256,000 when we were originally aiming for $200,000. And even then, that was a pretty ambitious price point for sale homes. Condominiums, they're just not easy to build in this area or in general. So it's not surprising to see that only 20 were built. But it is just something that we're reporting on just because it was originally a target in the strategy. For workforce housing, that's again, workforce housing is referring to housing that's affordable to families earning up to 100% of area median income. And we were hoping for 2,000 new rental units, and we saw about 755. That does exclude supportive and senior affordable units. And there's just a note here that we didn't create targets for market rate apartments. We did. Student beds are typically market rate, but otherwise we weren't tracking all rental units being built in the county, just the ones that we were targeting for affordability and other needs in our community. For senior housing, we saw about 68 subsidized housing units built. The Medicaid assisted living program doesn't seem to be active on the New York State level, so the fact that we don't have one in Tompkins County isn't Tompkins County specific. It's more just the timing of the program at the state level. We're not sure if that's going to become reality anytime soon, but it's not in the works right now. For market rate senior housing units, we saw about 113 built since 2016, but those were open to the general market after they did not have the full lease up that they were expecting. So, for whatever reason, they weren't successful in renting out those units to seniors at that price point. For supportive housing and special needs beds, the original goal was to have 100 beds of permanent supportive housing, and we saw 189 units built since 2016. So that was a great thing to see. We did not reach the target for single room occupancy beds. Reserved for those under 30% AMI. There might be some naturally occurring in the market, but none that we saw like officially reported out. And the Continuum of Care released Home Together Tompkins in 2022, calling for additional beds and low barrier shelter beds, and those targets have not been met. And then this chart on the right just shows the counts for those experiencing homelessness for the first time and those experiencing homelessness for at least one night. And that's for Tompkins County. So what we see is a slight increase over time from 2020 to 2024. It's a little bit of up and down, but we see that slight increase just demonstrating that continued need to create more beds. And as previously mentioned, for student beds, we did see the target met for 2024. Again, that was based off of the enrollment numbers that we were tracking for Cornell University and Ithaca College. We're also tracking to see how many of these new units are being built in our development focus areas. A development focus area, or DFA, strategy was created for the county to encourage development in areas that already had access to transportation, infrastructure like sewer and water, and already a developed downtown area so that if you're building housing or other infrastructure there, it's like already supporting kind of what's there, and it also helps to reduce sprawl and keep people connected to the rest of their communities and their essential needs. So what we saw was about 61% of all new housing was constructed in a DFA, with the largest proportion built in the urban center. And the urban center covers mostly City of Ithaca and Lansing. And so that's a great thing because it just means that housing development's being focused in areas where people living there will have closer access to their needs or transportation options. So the housing strategy overall has a lot more information on commuting patterns, more economic trends, other housing scenarios. So if you're interested in seeing kind of more of the nitty-gritty, I would highly recommend checking out the report. It's available online. But some of the key takeaways from this presentation today I wanted to go over was that the housing strategy targets, which is what we're counting all these units against, that was adopted in 2017, and the economy is very different now. It's 2016. So it's calling for a new strategy, which the county is actually working on now. And we also see that there's an acute need for more affordable and permanent supportive housing as housing costs burden continue to increase for renters. We already didn't have enough units based on our strategy before, and now we're really behind, and we're seeing that co cost difference increase. So, being able to focus on those developments would help a lot of people here that are experiencing that cost burden. Additionally, homeownership remains out of reach for those without significant cash savings, and it's still expensive to own a home as well. Though we just don't see as many homeowners experiencing that cost burden. If you're a homeowner, you're more likely to be less cost burden in general. So that may have something to do with it. And we're also seeing the trend of smaller households and aging households. This is a trend that we see across the state and across the United States. It's not just a Tompkins County situation, but that does also inform that we may want to be focusing on smaller unit development instead of these 4 or 5 bedroom houses that just aren't meeting the needs of the people who are living here or moving here today. And that's the presentation. Here's our contact information. So I'm Shawna, and then David's also here on the call, and I think we'll just take questions now. Again, I'm happy to share the link to the snapshot with anyone in this call today.
Hi, folks. I'm David West. I'm the Housing Community Development Director. Work with Shawna. Shawna, that went great. I think it's an exciting time for housing in the county that we can take a step back and look at what's worked and what hasn't. Um, we see a lot of successes, and one of the things that I think is interesting about the last strategy and our snapshot is that we really didn't set any targets for um, market rate rental, and we know that's a huge part of the development that actually works financially without the limited subsidy that's available from government. And there's been huge strides there. And one of the big takeaways for me from the snapshot is that our vacancy rate has gone up. According to our snapshot, it's still not quite at healthy levels, but it was at extreme shortage levels several years ago and is now, depending on the source, either just below healthy or in the healthy range. And that means that people are having more options. And we do see that that market rate development does have an impact across the whole housing market. So as we look at our next strategy, I think we'll be incorporating a broader look at the housing market so that we can see that whole picture. And also looking and seeing there's definitely places where we are not building enough of the kinds of housing we need. Um, so we may need to think about doing more. The county does a lot already to encourage affordable housing and senior housing and housing for people with special needs, but there's more that can be done. And this is an opportunity to say, if we want to actually achieve those, we're going to have to be more creative and take additional steps. So, this is my favorite part because now we're here to answer your questions, dig into things that maybe you found confusing or want answers on. And we can also do that anytime Sean and are here, and love to hear from the community. But I think it's great to have these opportunities right after the presentation to get into it.
You just said something that made me have a question. Uh, and I'm wondering about the role of rehabilitation for our existing, because we have a pretty like our naturally occurring affordable housing is in pretty poor condition at
Mhm.
this point and aging. Is there a strategy or a role for rehabilitation of natural affordable housing that can remain affordable that Tompkins County can be part of? And can I be part of that group if it happens? That's a thing that I've been seeing is like there is some stock, but it's not safe, decent, affordable housing.
Yeah, I think there's two sides of that. It's really funding is bifurcated on owner occupied and rentals. Um, but a program that the two programs that the county runs have had a big impact on the owner occupied side. So the county directly applies for funding from CDBG for low income homeowner home rehabilitation. And that program is generally run by INHS. But essentially, every few years, we get around $500,000 that goes into rehabbing homes that are owned by low-income homeowners. I will say that one of the things that we tried this year that was new was including longer-term affordability restrictions on homes that got more than a certain amount of money. Um, that isn't something that's been done before. There is like a short window of depending on how much money you get. It could be recaptured at sale if you sell at market rate. Um, because that does often happen. You put $100,000 into someone's home and their job changes, and 3 years later they're gone, and it's just sold on the open market for, and then the affordability was to help that one person, but it disappears as soon as it goes into the market. So we were experimenting with if you got more than a certain dollar amount, it would come with resale restrictions that were longer lasting, like the INHS Housing Trust. Um, that in its formulation this year did not work out. Nobody wanted to, basically the gap between the work you could get done for under the threshold, people just wanted to stop there and not um, get into a resale restriction issue. Um, so, but we do support approximately 10 houses a year around the county through grants the county gets. It's a drop in the bucket, but it's making progress. We also fund municipalities through our housing affordability and supportive infrastructure grant program, going after that same pot of money. And that has become huge. Before we started the program, Groton did that a lot. Since we started the program, Danby has been through 3 rounds of it. They just got $700,000 for this year for the town of Danby. Dryden has been going gangbusters with it. Um, Notice I'm not talking about the city of Ithaca because they get automatic allocations as from HUD without having to apply and compete for it. But that is growing on the homeowner side. Um, but again, it doesn't come with the long-term affordability guarantee. It definitely helps the people who get it. On the renter side, we can also do rental rehab. Um, it tends to be better funded through programs that INHS does directly, like home, that we don't have to apply for. Um, the town of Danby did do a multifamily rehab, which is for like private market multifamily. Um, so far, we haven't managed to have that program at the county level. You have to develop a wait list of multifamily owners who are willing to accept that restriction. And um, so far, that hasn't worked out. But I do think that we have to meld those two together of we do have a lot of housing that's old and really needs the repairs. How do you get that? Yes, but then also meld it with not just being a engine of gentrification, essentially.
Thanks. Thank you. Um, I assume that's Anissa, but it says IURA has their hand.
Yes, it's me. It's
Hi.
me. Hi, David. I just wanted to jump in and also say that just like David was mentioning, INHS does homeowner rehab in the county. They have also been funded by the city with the HUD funding that David has so eloquently pointed out is entitlement funding here in the city. INHS is wrapping up several years of a project doing that. They haven't been funded for next year. They've had some struggles in the city of Ithaca since the pandemic for many reasons. One is a shortage of contractors, and inside the city, there are some different code requirements than other places in the county, which make it a little more challenging for those contractors, maybe less inclined to want to take on these small projects. I will say one of the reasons that INHS had set mostly a $25,000 threshold for doing homeowner rehab in the city is because above that, there are a lot of lead and asbestos removal requirements. There are also for under $25,000, but they become kind of exorbitantly expensive. And so that's one of the things that is difficult. You might be wandering around the city as I have and notice a house that you can very much see from the outside needs a lot of rehab. A lot of times, houses that are in like severe distress, I would say all the time, are not really eligible for this type of rehab because INHS has to do a scope of work where they can complete the entire project within that $25,000. Kind of a complicated answer, but I just wanted to jump in and say that. And then there's also mini repair, which is for homeowners. It's focused on more health and safety type projects that are smaller. That might include um, you know, things like replacing not oven fans, the hoods, and other things that might be like cause accidents or fires or things like that. But that's also something that people inside the city can take advantage of. And I'm not sure, David, if that occurs, if the INHS does that in the county as well. I've forgotten.
The emergency repairs.
It's called mini repair for like small
Oh,
kind of household
yes.
repairs.
Yep.
I do want to give a shout out though to INHS also in their homeowner repair. They have addressed a couple of people's need for emergency boiler repair this winter. Sorry, go ahead.
No, yes, they do that countywide, and they've expanded outside of the county as well. They do
Oh,
a
great.
fantastic job of braiding together different funding sources that to meet with the requirements of an individual person. That's one of the things I like about recommending them to folks and having some of our programs go through them is if you come to them and you don't qualify for our program, they know of three other programs that they might be able to help you with, or they can do the work that works under that program with that funding and also other work at the same time.
Martha, I see you have your hand up.
Thanks, Liddy. Thanks, Sean and David. Sean, I think you said something about in commuting that there are data in the full report on trends on in commuting because that's kind of the opposite side of this. If there's, for example, a lot more retired people living in the same homes but sort of stable employment, that kind of computes that there must be more commuting from outside the county. And then I'll just dump in a question about federal cuts to housing supports and from vouchers to LIHTC, and if either of you could comment on what's coming down the pike. Thanks a million.
Yeah, I can comment on the commuting aspect. So, the data sources that we use, you can't really accurately compare like the 2020 commuting data to 2022. It's just aggregated in a way where the data source says, please don't do that. So we didn't. But what we did see is that we have about 22,000 folks who live and work within Tompkins County, almost 21,000 people in commuting to work in Tompkins County, but almost 14,000 people leaving the county who live in the county to work somewhere else. Um, so this isn't like out of the trend that we have seen in previous reports, but it does indicate that we do have a lot of in-commuters. And previous studies have shown that, cost of living is definitely a consideration that folks have when deciding to live in the county, even if they're working in the county. So, a very interesting change that we saw too is there's a lot more people working from home now. We saw a huge increase of that, especially since 2020. So there's folks who may be working in the county but living elsewhere, or the reverse, living in the county, working elsewhere. So those trends get a little murky, but it does show, that there is like some commuting that's happening, especially for young folks who they were the highest proportion of people to be employed within the county but live outside the county compared to so people 30 years or younger are more likely to be commuting in than any other age group like 30 to 54 or 55 and older. So there is a couple sections in the housing snapshot that specifically go into that. In terms of other funding sources, I'll let David or Liddy maybe talk about that.
I there's kind of two different things that you asked about with funding, Martha, and I think I'm qualified to speak on one of them. So, for LIHTC, we're we're seeing the value of LIHTC falling significantly. So even without reducing the amount of it that's offered for, I'm using the acronym, the Low Income Housing Tax Credit, is basically a neoliberal way to fund new affordable housing, multifamily development. It's the main way that new affordable apartments are built. And instead of directly funding the construction of housing, what the federal government does is they make available tax credits. Um, the state then allocates those tax credits to projects, and then the projects sell those tax credits. So maybe you could be allocated $8 million in tax credits and then sell them for $7 million to somebody who wants to reduce their taxes. Obviously, they're not going to pay, you wouldn't pay $8 million for $8 million in tax breaks because you wouldn't be making something there. So they buy it for less, and then the builder essentially has the purchase price to fund their project. We're seeing the value of those credits go down as other investment mechanisms in the economy are more profitable. There just isn't as much of a market as there used to be for those tax credits. So the existing amount of tax credits we're seeing reduced. Um, I I wish I had a crystal ball to know where we're going to go with HUD funding overall. I think it's a very confusing time for following that right now because um, so far, the programs that we work with haven't been impacted, but we see the impacts coming. I think Liddy's probably a better person to talk on the more direct impacts of programs that are hitting us. Right now, the programs that we work with are HUD dollars that went to the state previously that they're now allocating out. We don't have a clear picture on if they will keep getting those allocations from HUD. Um, and definitely the kind of terms of those agreements are changing.
Thank you. That good explanation of LIHTC. That's great. And I think as other tax credits, tax reductions are built into legislation, then people don't need to find in LIHTC.
Yeah.
I don't have time or all the information to speak about the HUD cuts that are going to be more directly impacting, local people experiencing homelessness or living below 30% area median income and using housing choice vouchers. But I will say that the THUD bill is either done or very close to making its way through appropriations. And so there will be some more clear answers like within the week. And I can maybe even try to put out a small explainer for Tompkins County about that um, THUD appropriations and that's the closest thing to a crystal ball we've got coming, I'd say. Um, but
Got
it's
it.
not great. The ideology has changed so drastically that, for at least from my perspective, working with HUD in the continuum of care, they went from being sort of my greatest partner and ally and teachers and all of those things to like a literal enemy to the very work that they had so lovingly supported me and us in before. So it's a really unsure time. It's really sort of scary. And it is at the COC level completely politically motivated and ideological in the changes. So they're not necessarily um, based in evidence or data or outcomes. But and which normally, like most of us would think, like, well, that can't happen because there's no evidence to support that. But because they're so strongly aligned with the current political ideology at HUD, HUD is like the most aligned of the department. If you go to their website, you'll know what I'm talking about. It's just hard to say, I guess, what is coming and how it will look. Um, yeah.
Okay. Thank you
Uh,
very much.
I do thank you again, Shawna and David. That was awesome. I love the housing snapshot. I've been following along with it for years and years, and it is really, I think, helpful for everyone to kind of know. First of all, know like there's a plan. People are paying attention to the plan, because I do sometimes hear in various spaces like, what's the plan? And it's like, there is a plan. I swear there is one. There's a few of them. And so it's always great to like check in with that plan. So I appreciate you
Liddy,
being here.
oh, can
Yeah,
I ask one question?
yeah. Just
This is
hi,
Marty
Marty.
Gold from
Hi, Jen.
DSS. Um, I was just wondering, given the cost of building new housing, given the difficulty in getting, in subsidizing housing in so many ways, are there any plans, initiatives, work going on in looking at less costly alternatives? To developing new housing, whether we're talking about small units. I know SROs were something that was difficult to develop, and any way of, developing them in some way, or shared housing. Just curious to know what is going on in terms of discussions or planning for the future.
Yeah, Marty, I think you are touching on a really important point, which um, comes down to a few different things. I think as a whole society, um, we made a shift that, all of our things are pendulums that swing back and forth. So, in the more distant past, we had really, really low quality housing, and that was relatively accessible. There was lower homelessness when, a lot of people lived in shacks, and we had a lot of problems with that. There were fires, there were sicknesses, there was, sanitation issues, and we made a lot of rules that have made housing more and more expensive to build. And you have to go through a lot of approval processes and you work with, five different departments in the community that you're trying to build in. And, you have to put in sprinklers that cost $20,000 on top of whatever the other cost is of the building. And we have really great environmentally helpful energy efficiency requirements, but they're quite expensive. Um, and we've made it really expensive to build any house. And then on top of that, we live in capitalism, so people have to make money, and the cheapest thing they can add to a house is square feet. Um, so kind of like car makers are being pushed from small cars to big SUVs because the cost to make the car bigger is less than the additional profit you can make. The same thing happens in the housing market where the producers of housing go bigger, more luxurious because the difference in cost between a bare minimum house and a more luxurious house um, makes more profit than it costs to get there. Um, I think we need to look at all the sides of that cost continuum and also do more to leverage what we have to get development that maybe someone wouldn't do without the county being involved. So that might be using county-owned land and saying, we want you to build 800 to 1,200 square foot homes instead of 2,600 square foot that is more profitable. Even with small homes, we see that the cost of construction today is huge. We're seeing 3 to 5, even higher, $100 per square foot in costs. I pulled a list of in the last 5 years the new single family homes that have been built for sale. And first there was only about five, and they were all in the range of $700,000 to $900,000 for, and that those are the only new houses being built. So we're not building any of kind of mid-market houses. You can build a simple basic house now for around $400,000. But that's above our median. So we're kind of in this weird position where our housing is cheap for the country, but high for our area. So the median income the median house price nationally is around 500,000. So houses here, our median house price is below the national median, and below the cost to build a new house. So I was just talking to this company that I think is doing really cool, efficient, small factory built homes. And they said, homes in your area are selling at too low. Like we would be the very top end of the market, and that's risky. They don't want to come and be the top end of the market. They want to be closer to the middle. But our homes sell, the existing homes that often need work sell for far below what it costs to build anything new. So the places that I see some room and some light are when people build their own homes. They can get a lot of efficiencies and build small, and they're not being profit driven. And I think there are ways that we can support that, including making it easier to get through the process because it's so complicated to understand the current building code and zoning and other things. It can be really hard for a small operator. And then the other is the state is pushing and has done really good work on manufactured housing installed on permanent foundations. So it used to be that you couldn't get a mortgage for a manufactured home, but now you can. And it used to be that a lot of municipalities could say it's illegal to put a manufactured home in a regular neighborhood. And that was made illegal by New York State, I think in 2016. Although I found the word is slow to trickle out. So a lot of my career has been helping municipalities understand that they need to fix their zoning to be legal to allow the installation of manufactured homes on single family home lots. So with a manufactured home installed by a developer, you can end up with a new house for sale just above 200,000. Even that isn't really going to, I've heard one person say they could sell them for 180. I haven't seen that pop up in the market yet, but we'll see. But that's kind of as low as our current technology and systems can get. that said, with someone doing small scale building by themselves, we saw, I think the units at Second Wind that are that like kind of minimum what you need to survive in a decent quality, those can be built for under 100,000 with, volunteer labor and other support. Um, so it's possible, but in the kind of profitable market, it doesn't yet make sense.
Thanks, David.
Thank you. Yes, this is a good reminder of all of the system in which we live and why it's so hard. It's really easy to be like, forget that capitalism is the backbone of a lot of this, and money and costs and development and all of that stuff. And so when we're seeing this end result, this symptom of essentially like late stage capitalism, which is people experiencing homelessness, it's very easy to like look at that symptom as the problem, when in fact, when we take this further view, you can see how it really is more like a symptom than the source. So that's why all of this is so important. So thank you so much, Shawna and David. I do want to get JD some time to talk about another exciting and depressing topic, which is upcoming changes to the essential plan. He said a lot of words to me about it the other day, and most of them I didn't fully understand. So I'm just going to hand it right over to JD here, and he's gonna give us an update. Thanks so much. You're muted. Should I knock on the wall?
There we go. I thought I did it all in one shot and then I didn't get that one. Sorry. Okay. So I'm going to give you some information on some of the changes that are coming for the New York State of Health. And, we'll do our best to keep you informed as we're informed. So right now, this is the biggest one, I think, probably that's coming. And it'll have like the most effect, right? So first, what I'll start off with is what my role is here. I'm a community health advocate. So we offer free assistance related to health insurance needs. And we help people with any type of coverage. It can be Medicaid or essential plan, employer sponsored or Medicare, anything that you have. And let's see, and we help with like medical billing issues, prior approvals, referrals to doctors, like trying to find doctors' names, that kind of stuff. So anything in that field we can help with, you can also contact us. But today, what I'm going to talk about, and I'm going to send out this slide deck. I'm going to send it to Liddy and she'll send it out. Later, it's just a lot of information, and I feel like looking at it is a lot when we're trying to talk about it. And then also, because I'd be going through the slides so fast, you'd probably just be like, wait, I need to see that. But this way you can have it afterwards. And if you have any questions, please feel free to reach out. So the first thing is this is all coming to the essential plan, and this is on the New York State of Health, right? The New York State of Health is, what was, how people applied for the health insurance after the Affordable Care Act, right? And then when you apply on New York State Health, you can get, the one application covers everything, and it covers Medicaid, Child Health Plus, Essential Plan, and Qualified Health Plans. That one application will put you in any of them that you're eligible for. It goes based on household size and income. And so if anybody's familiar, there's Medicaid and then Essential Plan. So just a little bit more of a little bit higher of the federal poverty threshold, right? And the one in last year, they actually started this Essential Plan 200, 250. And this June, it will be ending. So anybody who has that will be automatically transitioned over to a metal level plan, which looks much more like a employer-sponsored plan, right? There's a premium and a deductible, and then the co-pays and everything that you'll have to have, right? So to help out with this part of it, there is a cost sharing reduction that is available, and you don't have to do anything different for it. It comes automatically when you do the application, and it's just applied to the account afterwards. So it will change some of the costs that you'll have out of pocket. Okay, so there's going to be three different categories for the cost sharing reductions. There's the cost sharing reduction based on your income, and that goes from 250% of the federal poverty level to 400% of the federal poverty level. And that's solely based on your income, and you have to have a silver plan. You have to select a silver plan to be able to receive that cost sharing reduction. The next one is for diabetes. So if your primary diagnosis is diabetes, they will, and this can be for essential plan, the other essential plans, any of the qualified health plans. So that includes all metal levels like the bronze, silver, gold, and platinum. And the only thing it doesn't apply to is the catastrophic plan, right? So if your primary diagnosis is diabetes, there's going to be some cost sharing reductions that you'll get for that as well. And the third category is going to be pregnancy and postpartum care. And this again applies to any metal level, right? The gold, silver, bronze, or platinum. I did that in the wrong order, but you get it. So, and this is going to bring down the cost of care around those items too. Again, it doesn't apply to the catastrophic plans. Okay, so this is going to, the cost sharing reductions are only available for the income-based one in the silver plan, right? So when you select the silver plan, it automatically is going to go on there if you're financially eligible. And there are some numbers in there so you can see income levels that'll be able to get you to where you can guess where you need to be there. And then there's another sheet that'll have some costs that'll show you what the cost will be based on the current prices of the plans now. So I should tell you that this doesn't help with your monthly premium, right? The monthly premium is still whatever it is going to be, right? If you're getting an advanced premium tax credit that's going to help you pay it, you will still pay that monthly payment. This is going to help with things like your deductible, some of the out-of-pocket costs, depending on the doctors that you're seeing. Yeah, and then around the diabetes and pregnancy, there's going to be more along some of the medications and some of the treatments that you'll have or may need. Okay. So around the cost sharing reduction for the diabetes, they're hoping that this improves the access to the recommended care, right? And lowering the likelihood of unnecessary hospitalizations and improving overall health. And let's see, so New York State is pursuing this plan in order to address the health inequities focused on conditions such as diabetes that disproportionately impact lower income communities, including communities of color. They think that that's important to let you know that that's why they're doing that. So then let's see, some of the stuff that you'll be able to get the cost sharing reduction on is going to be you'll have like unlimited primary care visits, one dilated retinal exam per year, one diabetic foot exam per year, unlimited nutritional counseling visits, and then alcohol, let's see. I'm sorry. No, sorry, these are some of the medications. I'm sorry, I did that wrong. Diabetic supplies and medications. And then you can read that on your own when you get this, if it's something that you're interested in learning. But this is only a few of them. It does not cover all of them. You can go to the plan's website or to New York State of Health. It's nystateofhealth.ny.gov, and you'll be able to find the entire list there and all of the other things that it will cover. Okay, and there's more of the medications. Let me get past that. Okay, so for pregnancy and postpartum care, this includes services during pregnancy and up to 1 year postpartum. It applies to everything except hospital services, and it does not apply to ambulance services, all inpatient services, emergency care in the hospital, and delivery services by a physician, nurse, or midwife. Okay, so it will cover midwife services. They just have to be a certified midwife in order to have that covered. That's usually one of the questions we have. Okay. And again, and then there's some more stuff on some of the other services, some of the like it'll cover mental health benefits for pregnancy and postpartum, labs, x-rays, services, and supplies, some medications if that's required. And then again, not the delivery, but then it will cover like prenatal testing, breast pumps, blood pressure monitors, outpatient services, and some specialists. And you can also, again, visit New York State Health or visit the plan that you choose, and you'll be able to find more information on it there. So again, they just want you to know that you don't have to apply for this in a separate way or do anything different than what you would normally do with the application. And you can, do the application online on your own. You can contact your, local friendly hometown navigator, right? Like Liz and I are both here, and we can help you apply. You can do it over the phone with the call center. There's plenty of options if you need it. And then, we're always here to answer questions after the fact if you need that too. So this is just some of the changes, right, that are coming. And I guess the takeaway from this would be that they are trying to do something to help you reduce the costs, even though the essential plan is going away. The essential plan didn't have a premium that was due, right? So this is going to be a change. But they're trying to do something to help, cut some of the costs for you. And again, like right now, the essential plan is set to end in June. That could change, right? That could be different. But right now it's set to end in June. And if you don't do something ahead of time, right? If you have the essential plan now and you don't do something ahead of time, you will just transition over automatically from the essential plan into a metal level plan, and they'll just select it for you. So, but you will be notified if you do have it. You will be notified, and we'll keep you informed of any changes as we can. As soon as we know, we'll let you know. But this is the first one that we'll see that'll have the biggest impact, and it will cause some people to have a little bit of sticker shock when they haven't been paying a premium and go to paying it if that's what they choose to do. So I know that was pretty quick, and I hope I didn't talk too fast, but I'm going to send this to Lydia and she can send it out to you, right? And does anybody have any questions before, right now?
You have 2 questions in the chat. I'll read the first one first. Oh, and then Tara has her hand up. Actually, you want to go ahead, Tara? You're one of the questions.
I'm trying to unmute. There we go. Yeah, I typed it in, but maybe I misheard.
So it looks like there's a change for people 250% to 400 to move to a managed care plan, a silver plan. What about the folks who are in that 200 to 250% range?
So the 200, yeah, so right now 200 to 250 gets you the essential plan 200 250. And then but coming in June that will end, so the meta level plans are going to go from 200% of the federal poverty level all the way to 400. So and anybody who is already in the meta level plans, right, so they would be anybody from 250 to 400 currently. They will stay in those meta level plans. They're still able to get the cost sharing reduction if that's what you're financially eligible for at the time, or you have the primary diagnosis of diabetes or need it for the pregnancy or postpartum. But so they'll be eligible to anybody, but they're doing it at the time, like they're bringing these. They started in 2025 with doing these, and now they're making a big push that this is all known. Now because of this transition. Before, like they were there, right? The cost sharing reductions, they were there. But it was something that people didn't know that they actually qualified for until after the fact, right? Like you go through the whole thing and you'd select a plan, and it doesn't show you ahead of time what the cost would be. So with the cost sharing reduction, right? If you're getting a silver plan, and so we'd go through and we'd select a plan based on the cost that you were seeing, and then you see that your deductible all of a sudden was brought down to $300 versus the, let's see, yeah, $350 versus like the 3,200 that it was before. So now they're making an effort to make sure that it's known that they're trying to do something to help lower your cost. Does that answer your question?
I think kind of. I'm on one of those plans and it doesn't make sense to me. So I'm very curious.
Please feel free to give us a call, right? Liz or I, or make an appointment online, and we'll be happy to talk to you about what the changes are. And we can take a look at your account and we can see what you've got now, and if we can help, maybe tailor that explanation to what you've got. Okay. Were there other questions?
The other question was from Carolyn in the chat. It said, if someone has an essential plan, oh, maybe this isn't quite exactly the same, but if someone on an essential plan has experienced a reduction in income, how do they sign up for Medicaid instead of the alternative insurance you mentioned?
Just by doing the application. So updating the application information. So if you did it on your own, or if you see a navigator, however you want to do that, you can update it at any time during the year. And if you were an essential plan income and then have the reduction in income, it will automatically put you back there when we update the application. It'll automatically put you into a Medicaid plan versus the essential plan.
Thank you.
Okay.
Awesome. Thanks, JD. What I'll probably do is when I post the recording on our website, I'll post the slides that JD mentioned. So if people want to check back to look at slides, that's where they will be. Thank you so much, JD.
You're welcome.
There's been a lot of information today. I do want to take a minute to open the floor to basically anybody that's here who would like to raise their hand, make any announcements, introduce themselves, let us know what's happening, anything in that vein. I know that sounds scary, but it's not. We're a friendly bunch. So I just wanted to see if anybody wanted to say hello, have any announcements. Okay, you don't have to. I wanted to, this is not an event that HSC or Continuum of Care is necessarily affiliated with, but tomorrow, February 5th, CNY Fair Housing is hosting two trainings about fair housing. One is targeted mostly towards landlords, and the other is targeted mostly towards tenants and service providers. I went to some version of this a few years ago, found it very helpful. I'm going to go again tomorrow to get a refresher in the fair housing law. But I just thought that was something that this group might find interesting. So I'm popping that in the chat for you. Other than that, I think we can pretty much adjourn. We will be meeting again with this group, the Homeless and Housing Task Force. Meets every other month on even numbered months. So we'll be meeting again on April 1st, at which date we have a scheduled presentation that I'm aware of already from Adele Ayers at Tompkins County DSS, in partnership with the SNAP working group to really dive into some of those upcoming SNAP changes. So I think that's a presentation that people are going to have various opportunities to see, but I wanted to put it on your radar just in case you wanted to come check it out. All right. Well, thank you all. Have a lovely day. That's in April 1st. I think that there's other versions of that presentation happening in other spaces, but here it will be on April 1st. Always reach out to me or my agency with you if you have questions. Liddy Barger. That was JD Drader. We're office mates. I can knock on his wall, or we're neighbors. I could knock on his wall from behind my desk. But thanks so much for being here. Have a lovely day. Go out there and do great work. Thanks so much. Bye-bye.